Okay, so the camera is still on, and now we are going to look at the patient's chest again. It's symmetrical. I don't see any lesions noted on the skin. The skin's intact. I'm just going to feel here. Any pain or tenderness?
No.
Okay. Caroline, if you don't mind, I'm actually going to ask you to go on the other side of the bed so I can see and listen to your chest from the posterior side. Going to get my pen and here. Okay, perfect. Going to move your hair up. Okay. And can you just lift your shirt up just... Actually, do you mind taking it off, just the back side, and we can put it back on when you turn around? Thank you very much. Okay, so I'm also inspecting the patient's skin again, just for any lesions, anything abnormal, which everything seems to be fine. Can you take a few deep breaths for me? Okay, perfect. Respirations are even and unlabored. She's not using her abdominal muscles to breathe. Just gonna feel. And let me know if you feel any pain or tenderness. Any pain?
No.
Okay, and what about your sides?
No.
Okay. And I am now going to percuss the patient's back. Put the camera down just a little bit further. Okay. Okay, we'll do it one more time. Okay. Any pain?
No.
Okay. And I'm going to go ahead and have you say 99.
99, 99, 99, 99,
Okay.
99,
And one more time.
99.
Okay. Going to percuss one more time. Okay. And if you could take a deep breath in for me and hold it. Okay, and release. Okay, and go ahead and take another deep breath, let it out, and hold it. Okay, and let it out. Take another breath. Take another deep breath and hold it. Okay, let it out. Okay, and then take another deep breath, let it out, and hold that one also. Okay, you can breathe normally. I'm going to measure the distance between these spots. And I got 4 on the left side and 4.5 on the right. Okay, now I'm going to check the thoracic, thoracic spot here. I'm going to pinch just a little bit of skin and take a deep breath and let out. Okay, and then we'll do it just one more time. Okay, good. And I'm also going to check for CVA tenderness, even though this is not part of the chest portion, it's part of the abdominal portion. Any pain or tenderness?
No. No.
Okay. Now I'm going to take a listen to the patient. Breath sounds bilaterally. Okay. Okay, Caroline, you can put your t-shirt back on. And And I'm going to ask you to please lie in a laying position. And now we're going to go on to the heart assessment of the motor examination. Okay. You can go ahead and lay down. Oh, it's okay. Thank you. And I also wanted to note that if anything sounded abnormal with a chest assessment, that you're going to test for agophony, bronchophony, and whisper pectoralicu. Now we're going to go to the chest portion and put the camera down. I'm going to stand on the right side of the patient. And I also wanted to just say a few things before I start the cardiac portion of this assessment. And that would be that there are 5 main components to the cardiac assessment and what I'm assessing, which is the aortic, which is the second intercostal space on the right midclavicular line, or the right sternal border, the pulmonic, which is the second intercostal space on the left sternal border, the secondary pulmonic space, which is the third intercostal space, which is also on the left sternal border, the tricuspid, which is the fourth intercostal space on the left sternal border, and also the mitral, which is the fifth intercostal space on the left midclavicular line. Also saying that S1 is the closure of the mitral and tricuspid valves, and a systolic murmur is heard after S1. S2 is the closure of the aortic and the pulmonic valves, and a diastolic heart murmur is heard after S2. Now, if the patient is having difficulty or has anything abnormal with a cardiac assessment, we would ask them to sit up or to lay on their left side. Okay, and that's now going to put the camera closer to the patient so you can see. So I'm just going to feel the patient for any thrill or lift, which I don't feel. Any pain or tenderness?
No.
Okay, and I am also going to take a listen to the patient using the diaphragm of the stethoscope first, and then the bell. Okay. Actually, I'm gonna listen to him again under the patient's tank top. Okay, I'm gonna use the bell side now and do the same. Okay, good. I'm also now going to temporal arteries, the carotids. Okay, I'm going to also take a listen to those. now I'm also going to feel for the patient's brachial, radial, popliteal, and the other pulses in the legs as well. Okay, go ahead and put your arms flat for me. Okay, and I'm just going to move the camera so we can see where the legs are. Okay, very good. And now I'm going to move to the abdominal assessment of the patient. So you can put your gown back on if you'd like. And you can stay laying down because I'm going to listen to your abdominal sounds. Okay, so I'm just going to lift up your gown if that's okay. And I'm just going to inspect your abdomen. And I don't see any bruises, rashes, lesions, or anything like that either. And I don't see any distension noted. Going to listen in all 4 quadrants to make sure that peristalsis is present. Okay, and now I'm also going to just look at the abdomen, and we're going to palpate, just light palpitation. Tell me if there's any tenderness.
No. No.
Okay, now I'm going to go a little bit deeper. Tell me if you feel any pain.
No. No.
Okay, and I'm also going around the umbilicus for the aortic pulsation. Okay, and it's right there, and I don't feel any distension or any abnormal pulsations noted. Also now going to palpate for the patient's kidneys. So go ahead and take a deep breath for me. Hold it. Okay, and then let it go. And then another one. Okay, good. Now I am going to percuss the patient's stomach, and we're going to locate the spleen and also the liver. Okay, and the spleen margin's right about there. Okay, we're going to go from tympany to dullness, and then resonance to dullness. Okay, and it's right about there. Grab my marker. Okay. And it's right about there, so we'll take a measurement. Okay, and it's about 6, and the normal is 6 to 12. Okay. I'm also going to ask the patient to take a deep breath and hold it. Okay, and that's where you can also feel the liver, which we did. I just want to make sure that the camera is okay.